A warm welcome to you all from Copenhagen. I hope you can all hear us and see us clearly. A warm welcome to all the diplomatic missions, all who are resident and non-resident who are accredited to Denmark. Thanks for joining us today for this COVID-19 briefing and panel discussion. I'm joined here on my left by Dr. Hans Kluge. He's the Regional Director for the WHO European Regional Office, and I'm going to pass the floor to him shortly to say a few opening words. After Hans has said those words, I'll be passing the floor to Drs. Kasai and Moeti, our regional directors, the WHO regional directors from the Western Pacific and from the African region. And we are very, very privileged to have you joining us today, regional directors. Sincere thanks. After that, we'll go to a panel discussion where I hope Dr. Søren Bostrom, the Director General for the Danish Health Authorities, will be joining us. We'll also be joined on that panel discussion by Drs. Dorrit Nitzan and Catherine Smallwood, who are from the WHO Incident Management Team on COVID-19 here in Copenhagen. So a warm welcome to all of you again. Thank you for submitting your questions. We will endeavour to answer as many of those questions as possible through the panel discussion, but I think at this point it only remains for me to pass the floor to Dr. Kluge to open the briefing. Thank you.
Good morning, Your Excellencies. Dear Dr. Takeshi, Regional Director from the WEPRO region, Dr. Moetu, the Regional Director of the Afro region, thank you for joining us for the briefing today. I would like to begin in sending our thoughts and best wishes to the people, family, businesses who are working together to manage and adapt to the COVID-19 in their communities, and in particular those in your countries and further afield who are being directly impacted by the virus. I also want to take a moment to personally and on behalf of the European Regional Office of the World Health Organization express our thanks and gratitude to those on the front line, our heroes, the health workforce, working day and night to serve our communities. There are three main messages I want to convey to you today. Firstly, we can beat the virus only through solidarity. The situation is still worsening and we need to stand together to tackle it. As of this morning, there are 207,996 cases reported in 238 countries, states and territories globally. The trend has now reversed, with China recording less than 45% of the global cases. 8,659 people have unfortunately lost their lives to COVID-19 so far. The European region is the epicenter of the pandemic today, representing over 40% of global cases. COVID-19 is a test of solidarity and psychological resilience that we simply cannot afford to fail. It is crucial that we all abide by the principles of international cooperation, transparency and solidarity. It is important we do this together, learn from each other and harmonize our efforts. It is up to us to make this happen. Here I would like to ask your governance to seriously consider to lift export bans on personal protective equipment, and also for those countries which has closed their borders to exempt the WHO teams that the countries are being requesting to us to go to your countries to support you. Also, as you see, with 3 regional directors present today, we in WHO stand in solidarity. Second main message is we should assure that health is kept at the top of the agenda. Investment in the health systems today is investments in the national security today and tomorrow. The course of history has changed in 12 weeks and we still do not know where this will end. As of this morning, there were 85,493 cases reported in the WHO European region, with the last 24 hours more than 11,000 new cases. 4 countries, Italy, Spain, France and Germany, account for over 77% of all European cases, with a rising curve. The lives of millions of people in our region are undergoing radical change. This is quite simply a new reality. The role of public health services is understood. The value of health workers is appreciated. And a lot of appreciation to the ministers of health who are the center of this epic battle. Our health systems and services are valued like never before. When the vulnerability and frailty of our way of living is appreciated, health is at the top of the agenda. Your Excellencies, honorable ambassadors and delegates, I applaud all of your governments, our member states, for the contribution of your human and financial resources, your energy and your goodwill for these global efforts. It is time to leave no one behind, nor on the sidelines. I would like to ask your governments to continue to reach out to us to assist however you can with the preparedness and response efforts. The WHO, the United Nations Foundation and partners have launched a first-of-its-kind COVID-19 Solidarity Response Funds that finances support to the most needed and vulnerable and support the WHO strategic preparedness and response plans. Here in the European region, the COVID-19 response plan is benefiting from the input and advocacy of Dr. David Nabarro, who has been appointed by Dr. Tedros as a WHO Special Envoy for Europe to assist us for the COVID-19 preparedness and response. I am sincerely grateful for his support. Your governments can be assured that the resources we receive to raise both human and financially are being prioritized in those countries where the needs and risks are higher and where health systems capacities are lower. I guarantee I will do everything to ensure the contributions are used efficiently and effectively. My third message is that addressing COVID-19 is an all of government and all of society responsibility. On the 11th of March, the WHO Director General announced the first pandemic of coronavirus in history. This was based on the 13-fold increase in cases in the previous 2 weeks and the number of affected countries across the globe. This was our call to action to every country to take its boldest action to fight the new virus, to triple the effort in an all of society and all of government action. I would like to ask your governments to coordinate and integrate the responses across all sectors, including a lot of effort and attention to the social sector to protect the elderly. The community engagement is critical. I ask your governments to invest resources, time and effort into risk communication and community engaging that puts listening on an equal footing as speaking. Dear Excellencies, there are 3 priorities. I will focus particularly on the first because it is so important. 1. We should apply rapid, robust and rigorous containment and suppression of COVID-19 outbreaks as they start. We must act quickly because the public health task and socio-economic consequences are so much harder even if we delay by 1 day or 2 days. But we must maintain the focus on containment and suppression even when community transmission is well established. We have seen from Southeast Asia experience that if we focus on this and do it well, we'll contain our COVID-19 outbreaks and reduce the need for damaging shutdowns that cause so much misery for our people. 2. To prepare and be ready. Every person, every health worker, every health facility must be ready to protect and care. Hospital preparedness and capacity is crucial. 3rd, every country, through community mobilization, must consider and implement social distancing. Social distancing is not social isolation. Social distancing is solidarity. Many of our countries in Europe are now acting to flatten the epidemic curve and suppress the COVID-19 outbreaks. As you will hear from the Western Pacific, from the African region, and from Denmark shortly, different containment and mitigation strategies are being applied so that fewer new cases arise over a longer period. We at the WHO Regional Office for Europe are working with you 24/7 to control this pandemic. We have provided expert support with 40 in-country missions over the past month, and we are working with partners, particularly the European Commission and emergency medical teams, to scale up capacity to respond. In closing, I want to repeat my 3 take-home messages to the governments. 1, please connect with each other and coordinate your responses and make sure that measures introduced by one nation help and do not hamper the response in another country. 2, please continue supporting the response with resources and acting in solidarity, including all and leaving no one behind, assuring the most vulnerable are supported. 3, please encourage communities and sectors of your society to be engaged and promote an all-of-government and society response. I thank you for your attention, your commitment, and all your efforts.
Thank you very much, Dr. Kluge. So we're going to go straight over to Manila now to Regional Director Dr. Takeshi Kasai, who is Regional Director for the Western Pacific. Dr. Kasai, can I hand the floor to you? Thank you, sir.
Thank you for the opportunity to join the call. As you are aware, the first case of the virus were reported from my region on the final day of the last year. Today, there are countries at all stages of the epidemic in the Western Pacific. This reflects the extreme diversity among our member states. Whatever the stage, all countries have been tremendously engaged and committed to prepare and for responding to COVID-19. And if you allow me, I would like to share a few reflections from this part of the world. Most importantly, this is an epidemic that can be pushed back. For the first time today, China has reported no new cases of local transmission, although they did detect and report some imported case. This is down from 3,800 new cases in a single day at the peak of the epidemic last month. The Republic of Korea, Japan, and Singapore have also managed to slow their epidemics and have been reporting lower daily cases count in recent weeks. As of today, including those countries, we have 16 countries and areas have reporting COVID-19 in my region. Most of these are experiencing localized a cluster of cases, though sometimes this cluster can be large. They're doing a contact tracing, extensive contact tracing, active surveillance, isolating the case, and quarantine. And together with this outcome of those contact tracing and the quarantines, and then multi-layer surveillance, we're not seeing strong evidence of widespread community transmissions in the Western Pacific region. We know that with those aggressive action, it is possible to push this virus back. But we also recognize that there is no one-size-fits-all approach to doing this. Rather, the situation in each country, sometimes even within the countries, is different. Responses need to be tailored carefully to their local context, and we must be agile in our action. But there is one factor that is common to all the settings: the need to mobilize all of society as part of the response, starting from the highest level with a strong political leadership from the capital and reaching all the way to far-flung communities who need also feel ownership of the response. Secondly, as many health issues do, COVID-19 challenges us to focus on the vulnerable. This, of course, includes those who are particularly susceptible, the elderly, and people who have underlying conditions. But I wanted to also highlight that this vulnerable includes our healthcare workers. who are not only the most exposed, but most essential part of the response. Thirdly, while we must respond to the health threat immediately facing us, we must also be thinking a step ahead and readying ourselves for a range of scenarios. This applies in particular to the phases in which we place emphasis in contact tracing and containment, which can provide us with an invaluable opportunity to prepare systems for large-scale community transmissions if we use that time well. As I said, every context is different, and I don't want it to imply that what works in some countries in Asia will also work across Europe. No. Well, which brings me to my final point. More than ever, this is a time for international solidarity and cooperation, as my fellow regional directors of Euro said. We know Europe's potential to stand together, and I wanted to reassure you of the commitment among the countries in our region to support Europe in any way possible, just as we appreciate the strong support we are receiving from Europe. In this situation, every European is Asian, and every Asian is European. This also applies, of course, to our international cooperation within WHO. I'm in very close contact with Dr. Kruger. We're exchanging experiences and stuff. And we consider ourselves as one team in responding to COVID-19 together with our colleagues at WHO headquarters. We are all facing a great test, but I'm confident that together we will overcome and emerge stronger. Thank you very much for this opportunity.
Thank you very much, Dr. Kasai, and we've already received a couple of questions for you that I'll pose to you shortly. But before we do that, I'm going to go over to the Regional Director for Africa, Dr. Moeti. Let's see where we are. Do we have the link to Brazzaville? Yes, we do. Dr. Moeti, I might invite you now to take the floor and say a few words. Thank you.
Yes, thank you. Thank you very much. And thank you, Hans, Regional Director Europe, for having invited me to join this meeting. Excellencies and colleagues, my fellow regional directors, I very much appreciate the opportunity to share some reflections and observations about the situation in WHO in the African region. First, I'd like to say that the European Union is one of Africa's best supporters in our work on development. And there is a strong relationship, I know, between the EU and the African Union, including quite significant levels of financial resources, technical support for development in different sectors. So I find this really an opportunity to emphasize those strong links between Europe and Africa, which go back many years and which I'm sure will go many years into the future in this discussion of this global pandemic, having been invited by Hans. And I can only echo the words of my colleagues on the importance of global solidarity in our collective effort to address this pandemic, and the fact that we are seeing signs of it, and as WHO we see it as our duty to advocate for it and to promote it and to acknowledge it where it is happening. So it's a really great opportunity for me. As far as the African region is concerned, about 6 weeks ago, 2 months ago, we were observing, with some worry perhaps, that there were not very many cases in Africa. Not very few countries had cases and the numbers were down. So about 8 days ago, we only had 5 African countries with cases. Today, we have 28 African countries that have reported cases. So in the last 2 weeks, we've had an exponential geographic spread of this virus in the African region. We now have over 300 confirmed cases and 4 deaths. So I have to say, compared with what is happening in Europe and what's happening in Asia, this looks very little. But we are concerned about the speed with which it has occurred, and we're of course very concerned about the context in which it is happening in relation to the socio-economic situation of our countries and the status of our health systems and their ability to deal with this problem. We have local transmission, meaning community-level transmission in the African region in only 4 countries, in Algeria, South Africa, Burkina Faso, and Senegal. And all of these have arisen out of travel from European countries. Initially, we were very concerned about the strong link between China and Africa. It is one of African countries' top economic partners. But the majority of cases here have been sporadic importations, mainly from Italy, France, Germany, Spain, Switzerland, and the UK, and some cases from the USA. Again, demonstrating the strong links between African and European countries. We have carried out a baseline rapid self-assessment of the readiness in our countries, understanding that the starting point is of relatively weak health systems, and that includes weak preparedness to address outbreaks and public health emergencies in general. And I have to say that we are very encouraged by the investment in this work of the governments, of the international community. For example, a month and a half ago, we only had 2 countries and 2 laboratories that could confirm diagnosis of this virus. And now we have 41 countries that are able to do this through work that has been done by the governments and with WHO with the support of the Africa CDC. I won't give an assessment overall of the state of readiness, but to say that countries have built their capacity for surveillance, for point-of-entry screening, and are working very much on areas like contact tracing. Where we have the greatest challenges is in the areas of infection prevention and control and case management. This relates to the paucity of capacity for critical care in the majority of African countries, in the public sector and also in the private sector. And we observe that South Africa, which has one of the best developed health systems in the region, both in the public and private sector, is already acknowledging it will be challenged to deal with the number of cases that are projected to occur because of the rapid geographic spread of COVID-19 within that country. We also have a demographic that we believe needs particular consideration. We have, of course, elderly people who are greatest at risk. We have a high prevalence of HIV among young adults in the African region and have to understand what are the implications of this for the vulnerability in our population. We have very high levels of malnutrition among under 5 children in African countries. Does this also constitute a group, a population subgroup that might be more at risk than we have observed in other regions? This is what we need to be monitoring as we see this situation evolve in our countries. We have worked very hard with our member states as well to develop national plans. So 40 African countries have defined what they would like to do, and we are now logging those on the international platform for financing by the international community. What we have to contend with in terms of the particularities of our region is the fact that social distancing in some contexts in Africa may be quite a challenge. But in low-income settings, in the urban slums, in our countries, it may be quite difficult for a person to lock themselves away in a room in the home because there simply are not enough rooms in the home. So we will need to think differently about how to achieve this containment within that context. In many of our settings, we do not have access to water in the homes. So we are asking people to wash their hands frequently. We will then need very large volumes of sanitizers to be made available in households if we're really going to achieve some of these interventions. We would very much like to learn from the experience of our countries in Asia, China, and the other countries in terms of active case finding, meaning as a public health community, we need to be innovating in terms of what kind of testing can be carried out of people who are asymptomatic in the types of settings that we have in Africa. This is what we'd like to work towards. I'd like to conclude by saying that we are also strongly recommending to our governments that the types of measures that are being taken of multi-sectoral nature be based on evidence, that we look to contain and isolate the virus and not people, and certainly not countries. We have observed a raft of measures that are being put in place that are going to have an impact on the movement of people and on the movement of supplies and goods, including those that are essential for this response. So what we would like to see and what we would like to work with our colleagues to promote is a dialogue between the regions, between the European partners of Africa and our African political leaders, so that the strategies that are being put in place are mutually supportive and synergistic for control in both regions and also in Europe, in Asia. I'd like to conclude again by thanking the European Union member states and the European Union for the generosity in responding to WHO's global call for resource allocation. We stand to benefit from that in our region, and I'll echo Hans in saying we will do the best we can to make this have the best results and impact and manage those resources well. Thank you very much.
Madam Regional Director, thank you very much for those words, Dr. Moeti. So I'm going to actually pass the floor straight back to Dr. Kasai. I see also that Dr. Søren Bustrom, the Director General for the Danish Health Authorities, has joined us online. But Søren, I will ask that you just bear with us for the moment. I'm going to go to Dr. Kasai. I understand, Regional Director, that you're under curfew in Manila these days, so you're only with us another 10 or 15 minutes. So I'd like to pose a couple of questions to you that we've received both during and before this briefing. The first question for you is, what measures has China taken to prevent a second wave of cases? The floor is yours, sir.
Thank you very much, Hans and Excellency. Basically, what is important is to distinguish a response and then the preparation. Response according to the local situations. And as I mentioned, that China is really pushing back the virus. So basically, they maintain the vigilance and then try to capture the virus coming into their country. But they're also using this time to prepare for the large-scale community outbreak. And they're really now scaling up their health facility to be able to cope with this second wave. But not just a healthcare facility, they continue to communicate to the public to be ready in their mindset. And public is not just a community in a village, but they're also including the private sector, all those sectors to be ready for this next stage. So response according to the situations, but using that time to prepare for the large-scale community outbreak. Over to you.
Thanks very much. And we have a second follow-up question, which I think is related to this, and I possibly should have asked you first, is why is the situation much worse in China than elsewhere in the Asian region? And this came from 3 or 4 different embassies through to us here. I don't know how best it is to answer that, but I'm going to hand the floor over to you. Thank you.
Well, I think at the end we need to really review what is really the reason for that. But then there are multiple, I think, reasons contributing to this. One is very obvious one. Every country has certain level of surveillance with a different level of fineness. And the surveillance there couldn't detect those cases as early as enough. But I also wanted to emphasize these surveillance that they set up after the SARS, because of that, they detected. So there are both sides of these coins. But then there might be also other reason. For example, there might have some kind of place that amplify the infection. And then we very much paying attention if the hospital was offering such kind of amplifying opportunity. And then we really emphasizing my member states to really avoid people rushing to the hospital and overwhelm the hospital, and then that becomes a hotbed, i.e. the places for amplifying the infections. Over to you.
Thank you very much again, Dr. Kastheim. We totally understand if you need to run off at some point during this call. So thanks very much for joining us, and please stay on for as long as you can. So before we go back to the questions, and I see we also have a couple of questions for Dr. Moeti shortly, I'm going to ask Dr. Søren Bostrom, who's the Director General for the Danish health authorities, where we're sat here in Copenhagen, and where many of the embassies and ambassadors that are online with us today are based. I'm going to ask Dr. Bostrom to say a few words around the Danish situation and the measures taken here in Denmark. Just shortly, please, Søren, I will hand the floor to you. Thank you. Søren, are you with us? You may be on mute. Okay, doesn't look as if we've got Dr. Bostrom online, so I'm going to move on and invite Dr. Moeti. Maybe we could start with you. We have a question here, which relates to something that you said earlier about the preparedness across the African region. The question is, how confident are you that the region is ready? And related questions to this, we had 3 or 4 different related questions to this, but I think it's best summarized in the level of confidence that you have as a regional director that Africa is ready. I'll pitch that over to you, please, regional director.
Thank you very much for that question. I think we have to acknowledge that no country in the world is ready and was ready. But I will modify that and say that we have seen preparedness being improved in the region significantly in the last few months. As I've said, I gave the example of the laboratory capacity to diagnose and confirm. That's very important for countries to be able to do. The surveillance systems in place, not only at points of entry, but also in health facilities in countries, is also reasonably prepared. Not to the degree we would like it to be, but it's been capable of picking up cases who have not been picked up in the point of entry screening. As I said, virtually all the cases in Africa have come from elsewhere, and people have walked through the airport temperature screening and then started to fall sick a couple of days later, reported at a health facility for treatment and being picked up as a case. So that is working, and then pretty quickly after that, they've been able to be confirmed as a case, and then the measures of following up contacts have been carried out. There is need to improve the contact tracing coming out of those plane loads of passengers who are landing in African countries. That is true. And one of the areas that really does need a great deal of effort is infection prevention and control, so that the health facilities don't become the nodes of transmission, both in terms of the practices, the training of healthcare workers, and the supply of personal protective equipment, which is in short supply across the world, I would say, including in African countries. And then in addition to that, the capacity to manage cases with different severities of illness, particularly those that are critically ill. There is a great deal of work going on as we speak to build the capacity to conduct training, to bring supplies into the countries. So if there's one thing I can say as a key message for collective work internationally, is to really increase the production of the key commodities that are needed to respond, and to ensure that they are able to be transported and moved around the world to countries where they are needed.
Thank you. Thank you very much, Dr. Moeti. Something you touched upon there was the hospital preparedness, and so I'm going to pass a question over to Dr. Kluge now. We have a question. What is the number one priority action here with preparing our hospitals? How do we best prepare our hospitals? Dr. Kluge.
Thank you, Rob. A number of points here. I think my colleagues, region directors, mentioned it already. The paramount importance of infection prevention and control, and to segregate the COVID-19 suspects and patients from the other ones. And this is important because it also reflects on the personal protective equipment. This will be a first one. Second is to slow down, if possible, the elective work, like the elective surgery, so that everyone is really hands-on to deal with the COVID-19 responses. and this would include to liberate the nurses in the theater, the anesthesiologists to really be hands-on. And then, as we saw in Italy also, in a number of countries where the health system competency lays with the regions, a very strong collaboration between the national level and the regional level to coordinate not only the work in the hospitals, but hospitals, primary healthcare, social care, which again links back to protecting the elderly and the people with underlying conditions.
Thank you very much, Hans. I might ask Dr. Dorrit Nidsan to come in on this point as well from the incident management team here in Copenhagen. Dorrit, please.
Yes, just to add to our RD, indeed we are recommending to focus and to get all the energy that the system has focusing on those that are critically ill, to develop home care and emphasize the ability to care at home. And as we heard from Dr. Moeti, we need to think outside the box and to look for other solutions when home care is not available. We have some examples also from the European region where people were put in quarantine or isolation, those that were sick, and under following WHO guidelines, how to do it. So this is an important side. The main thing, and I think our RD said it very clearly, IPC, the infection prevention and control, healthcare workers, they are the ones that need to be at the forefront, including diagnosis at the point of entry to the hospital, not to allow people that come with any other symptoms to meet those with the suspected coronavirus. Thank you. Over to you, Rob.
Thank you very much, Dorrit. And I'm going to go back over to Brazzaville, if I may, to Dr. Moeti. There's another question here. It's regarding the environment and the spread of COVID-19. How is this likely to be different in Africa than in Europe? And I can also ask our technical team here to maybe make a few comments on that. But first, I'd like to go over to Regional Director Moeti. The question was, how is the environment and spread likely to be different in Africa than Europe? What messages are you sending to the communities? I assume that means what are the member states, the ministries of health, the health authorities sending to their communities? Over to you.
Yes, thank you for that question. I think the environment in the sense of the living conditions, because essentially we are asking for people to isolate themselves sometimes, keep a social distance from others, maintain basic hygiene. Those I think I've already mentioned some of the differences between the situation in Africa and in other regions, meaning there may be fewer opportunities to be able to do that effectively, especially in certain socioeconomic levels of the society, and therefore this will need a slightly modified approach. We are sending the basic message that people need to maintain basic hygiene frequently, differently, and we will need to work with our water and sanitation partners in the UN. In fact, I just came from a teleconference with a group of UN regional directors on this. Some of them work on water. We've worked together on this when we have cholera outbreaks in Africa. Can we do that so that households that don't have access to water do have the opportunity to carry out these basic measures? Well, do we need to think differently about masks, for example? How can people who are compelled to be in the same space to work together? We have many social interactions in closed places. We are a very religious community. There are many churches. People go to mosques. What can we do here in order to maintain social distancing? So we are sending out these messages, working with the leadership of different communities, associations, and adapting this to the context in African countries. That's what we are doing. In addition, there have been many questions about the environment, more in other senses, the fact that it's hotter in many countries, the fact that it's very humid in others. And we are trying to analyze the patterns of coronavirus spread seasonally in the region in the past and see what we can expect as far as this virus is concerned and its spread, where we expect it to spread much faster. For example, we know that at the moment in the north, in the global north, is the flu season, and we're seeing very rapid spread. We're expecting in a very few weeks the flu season to start in Southern Africa. So we are, in a sense, preparing to see a dynamic which is different there and working with the country so that people take on those measures that they normally do for the flu season, but with this heightened intensity in relation to this virus as we are seeing it. Thank you.
Dr. Moeti, thank you very much indeed. Clearly, there's no one size that fits all, and that countries and regions are conducting different measures to suit the environment and the epicurve and the epidemiological spread that they see in their countries. And I think this next question is very pertinent regarding that. It reads, it would be most interesting to be informed about different measures taken in different countries and the implementation and success of these measures. Such an overview would provide member states with essential data and release capacities for other urgent tasks. So this is about collation and collection of measures, best practice, promising practices. On this point, I'll hand over to you, Dr. Kluge, to say a few words.
Thank you very much. Indeed, this has been a request, in fact, by several member states and also our governing body board meeting last week, the Standing Committee of the Region Committee. And we are taking this very rapidly forward, also with the support of the European Observatory on Health Systems and Policies, to map the different measures, both politically, strategically and technically, being put in place by the countries, and what does it mean for implications on the health systems and also the social and economic impact. We're also working parallel to a new web page to put this up onto the WHO web as soon as possible. And we were in contact yesterday with the European Commission, because the Commission is also collecting data from the EU member states to do this as a joint effort. Meanwhile, we continue with sub-regional video conferences. We had a great video conference with the Minister of Health themselves and the WHO representatives of the West Balkan. Next week, we will have one with Central Asia and China and Russia, etc. So this is evolving as of we speak. Thank you.
Thanks very much, Dr. Kluge. We have a whole series of questions related to vaccine production here. So I'll pick one of them that best represents the bunch. We hear different timelines for vaccine production. Can you give us the latest information on how long a vaccine will take to develop? I'm going to go across to Katie Smallwood, who's on the line with us from the incident management team here in Copenhagen. Katie, please.
Thank you very much, Rob. I hope everyone can hear me loud and clear. So, as you know, WHO is working through the R&D blueprint to really accelerate the research work in the development of new vaccines. This has moved extremely fast, and we have over 20 different vaccines that are currently in development at the moment. Of course, each vaccine will be faced with separate challenges. These are different processes, and they're going through a clinical trial, and different problems will come up with the different vaccines, and these may be at different technical levels, such as safety, such as stability, etc. So each vaccine will take its own course, but there's a huge international level of cooperation really to push things through and to bring research teams together. The good news, and I think the Director General announced it yesterday, was that we have now, over the past couple of days, our first vaccine that has entered trials. And this signifies really a huge progress. This comes only 2 months after the virus was first sequenced. And so this is really unprecedented in terms of how fast the research and development is moving. However, we need to caution all of this and just remind ourselves that normally vaccines take around 2 years to produce. So we will still face challenges and bumps along the road, but we'll see how fast this can go. That's it from me. Thanks.
Thank you very much, Katie, for that response. I'll be coming back to you in a moment because there's a couple of others regarding treatment. But before I do so, I'm going to ask if Søren Bostrom has managed to connect. We know he's extremely busy at the moment. Søren, are you hearing us? Are you there? No. But we hope that he'll be able to join us later. Stay tuned on that front. So we have a question here regarding herd immunity, and I want to pass this over to you, Dorrit Nitsan. The question is, what do you think of the approach of the Dutch and the British in relying on herd immunity? Dorrit, please.
Thank you very much. Well, it would have been great if we knew that there is evidence-based herd immunity. We don't have yet that information. That in any case, the peak of the epi curve is going up as we speak, and therefore we see that it's going and it's like a fire, a bushfire. What we ask countries is to do, as you said, the containment strategy together with the mitigation, as we do not have evidence yet for herd immunity. We are asking to do this blended approach of all different approaches that are set for that community or that country. So herd community, not yet evidence-based, unfortunately. Thank you.
Thank you very much, Dorrit. Thanks very much for that response. Now, the European Commission has come up a couple of times so far. Dr. Moeti mentioned the European Commission, and of course, Hans Kluge did. So we have a question here related to the coordination between the European Commission, the EU27, and WHO's European Regional Office. In these times, it is most important that we keep close ties. How is the communication and coordination working between these two bodies? So I think I'll hand that to you, if I could, please, Dr. Kluge.
Thank you very much, and I would like to ensure the member states, the ambassadors, that this communication is further being strengthened and very satisfactory. In fact, at different levels, at political level, between the European Commissioner on Health and Food Safety, Dr. Stella Kyriakidis, and myself, but also other commissioners like Enlargement and NEAR, and then at the technical level. To give one very practical example, very soon after the situation went exponential in Italy, there was a joint rapid response team by the European Centre of Disease Control and WHO, and then also a common debriefing. Similarly, on the health emergency committees, there is a joint participation. And now on documenting the measures and further trying to streamline policies and procedures, this is ongoing, but not only the European Commission. We have the larger European region, and member states are really looking to the regional office to be a convener between the EU, the Western countries, non-EU, and then of course the Eastern and Southern part. And there we also have other important partnerships like the Eurasia Economic Union and the newly independent States Council. Thank you.
Thank you. Dr. Nitsan, do you want to say a few words, or Dr. Smallwood, about the ECDC collaboration, the European Centres for Disease Control?
Yes, I can start, and Katie, if you have more to add. We are working really side by side and together. Our teams are collaborating in regards to surveillance data, reporting, and sharing information. We are taking part in the ECDC meeting, and they are joining ours whenever we have the common ground. And we always discuss in open way. And I think this is something that is evolving even during these days. We see how great we collaborate with different institutions, ECDC, and also our collaborating centers in other parts of the region. So it is, as our idea always says, solidarity and sharing of information are the key. And we are trying to practice it. Thank you.
Yes, Excellencies, I just wanted to point one issue out on the herd immunity that Dr. Nitsan rightly so answered, that the United Kingdom has stopped this approach. So they are also moving forward. So I thought for accuracy also to mention this one. Thank you.
Thank you very much to both of you. So we have a question also regarding EC coordination here on testing kits and personal protective equipment. I'm going to go over to Dr. Smallwood on this one. The EC coordinates the amount of testing kits and personal protective equipment, PPE, present within the EU and purchase thereof. Still, availability of these products are relevant to all WHO European member states. What role does WHO Europe see for itself on this specific point? What is the current state of supplies for the Euro region? Katie, can I hand that to you, please?
Thank you, Rob. Indeed, this is another area where we are in close collaboration with the European Commission. And in general, we're all aware, particularly with relation to personal protective equipment, of the global shortages that exist. And WHO has a key role here in ensuring, with the philosophy of solidarity and the fact that all countries do need personal protective equipment, ensuring the global supply chain. And we're working very hard to do that, particularly for the European region. While the European Union countries have their own mechanisms for both personal protective equipment and testing kits, WHO Euro is really working with the non-European Union member states. And we have distributed already a first wave of personal protective equipment, and that's gone to 17 countries. We are planning now a second wave of new distributions, but this is really minimal, and our focus and our constant encouragement to countries is really to seek local solutions where possible. This is something that we're acutely aware of, and we're working now in particular with China and some of the other countries in the Western Pacific region, look at new supplies of personal protective equipment. On testing kits in particular, there as well, we've delivered testing kits through the WHO agreements with certain manufacturers in the European Union to non-European Union countries. And so we have distributed testing kits to 16 European countries outside of the EU. And we are also planning on sending second and third waves of those testing kits when they become available. And we're scaling up those distributions as time goes on.
Very good. Thank you very much, Katie. Dorrit, did you want to add something to that? Dorrit, you're muted. You're muted, Dorrit.
Oh, sorry. Just to say that over this weekend, we also, as you know, Rob, we were doing from our office with the embassies of one country that is EU and another one that is not an EU country. We were supporting them as well and providing, since they were running short of lab supplies. So we are really trying to mitigate and bring everything to the ground, even to countries that may be able to purchase it later on. Thank you.
Thanks very much, Dorrit. And I might actually pass the floor over to Dr. Moeti, if I could, over in the Afro regional office regarding this. Access to testing kits and to personal protective equipment, to PPEs, Doctor. What is your current access, and what problems do you foresee in the future in terms of access to markets, to manufacturers, and of course the equipment and supplies? Dr. Moeti, please.
Yes, thank you. We've been able to provide, and so has the Africa CDC, some test kits and also personal protective equipment to most, but not quite all, African countries. This is one of our greatest concerns, actually, in terms of the quantities that are needed and the access to markets to make sure that we keep up the supplies of these to the extent that's possible, in order also to make feasible a more aggressive strategy for case finding and supporting the containment strategy. So this is one area in which we are working with our headquarters colleagues to determine what might be available. And we really would like to appeal for two things. First, a very innovative approach to exploring possibilities. There are many developers of test kits around the world. We need to be working with them in order to make sure, of course, as WHO, that they are up to the standard in terms of their effectiveness, but that we explore all possibilities to have increased quantities of test kits and testing methodologies that are adapted to the conditions that may be feasible in our region if we are trying in this many countries to be more aggressive. This is
vous pouvez peut-être bénéficier du pacte énergie-solidarité. C'est la possibilité d'isoler vos comptes pour une somme.
I think that's, sorry for the interference, it's coming from Dr. Bostrom's connection, I think, through, thank you. I think, please go ahead, Dr. Moeti.
Yes. I was going to make the same observation about personal protective equipment that we have been able to provide certain quantities to our member states. But as we are getting to the stage now of expansion geographically of the virus in the region and some countries starting to see community and local transmission, these two items are really the biggest concerns that we see and where we would like again to emphasize the issue of international solidarity that's been mentioned, and perhaps see the kind of public-private partnership where we work with governments to promote production and we identify the private sector entities to do the production and then the resources to create the market for procurement and supply of these items. For me, this is one of the most urgent areas. We are discussing that internally as senior management in WHO, and we hope to see progress in this. Thank you.
Thank you very much, Dr. Moeti. We have a question here. I think it's best for Katie to answer this one. How far are we away from treatment? What is the projection in terms of treatment being available to treat COVID-19 patients? Thank you.
Thank you. I would just preface this by saying that supportive care is and will always be essential in any treatment of patients with COVID-19. And this is what we've seen in a lot of countries that are dealing with patients with severe disease and needing critical care, is that the availability of high-quality centers for care for patients is absolutely critical. Now, when it comes to specific treatments, such as specific antivirals used either on their own or in combination, there again, through the R&D blueprint, WHO is bringing together an international community of researchers to drive research in an accelerated way. And we've got hundreds of clinical trials that are ongoing both in Asia and now in the European Union countries. So I'd like to draw everybody's attention to the Solidarity trial. We have the Solidarity Fund, which is really was already mentioned by our regional director. We also have a Solidarity trial. This was announced by WHO yesterday by our Director General. And this is a multi-country, international, large-scale trial that will be comparing previously untested treatments for COVID-19. The objective is to bring together smaller trials, smaller groups of researchers into a broader international study that will be heavily supported and coordinated at the international level. And this will come up, and we hope even within the next few weeks, we will already have some indications as to different tested treatments and how they're performing in comparison to each other. And so we'll have to keep a very close eye on that. But we expect things to be coming through very quickly within the few next weeks to months, and then we can drive forward the different therapeutics. But here again, just ending with supportive care is really, really important, and that comes back to the ability of hospitals to provide in a safe setting good care to patients that are coming in with severe disease.
Great. Thank you very much. Very concise answer. Thank you very much. Very informative. We will also now go to the RD because there's a specific question as to a regional director Hans Kluge. What does the Regional Director of Europe think of measures to distance ourselves from each other and stay at home? Hans, please.
Thank you. Very relevant, Rob. First and foremost, I understand that this previous question, I think it's important to clarify about herd immunity, which you get time and again. So I was telling that in the United Kingdom, this is not the approach, but similar in the Netherlands. And in fact, I got quite some questions yesterday and today, so I would like to formally state that one, that neither in the United Kingdom or the Netherlands, this herd immunity approach is being followed. So I would like to also make this state for the records. Then going to the question, indeed, this is part of the social and community mobilization. In fact, social distancing is physical distancing, right? It's social distancing is not social isolation, but it is really one of the top priorities nowadays. WHO has published guidelines also how to remain active in the home environment, including also working on moral and psychological resilience, because of course this has to be together at the home, and I also speak from personal experience, is really getting us together. We talk to each other, but sometimes it can be a little bit too much as well. So people need to be really resilient. So in that sense, it is really a very important measure, but do some light exercises. And of course, it's not by walking in the park alone that we are going to get infected. So common sense has to prevail, but indeed take distance, not socially, but physical distance from each other as a very important measure, as part of a comprehensive public health measure, as for example, the washing of the hands if there is water or disinfectants. Thank you.
Super, thank you very much. And maybe you could add a few more points in terms of, you know, whilst we have recommendations for people to stay at home, of course, there are those people that have to stay at home that are not able to receive salary, yes, and also, of course, that are not at work. Would you like to add a point on that?
Yes, this is what we discussed with the member states as well, and is part of leaving no one behind nor at the sidelines. In fact, I was speaking recently with the Minister of Health of Ireland, Minister Simon Harris, who is initiating a large-scale community initiatives how to take advantage of volunteers to provide social and psychological care for the elderly. So hence it comes back, Rob, to the whole of government approach.
Absolutely, absolutely. Thanks very much. So now we have a question to the Danish authorities, but actually I think it's probably okay to send this to Dorrit or to Catherine as well. The Danish authorities are no longer routinely testing for COVID-19. This is leading to confusion amongst people with mild symptoms, whether they have a cold, flu or COVID-19. Have WHO had any success in persuading the Danish government to do more testing? What advice does the WHO have for people who have unspecific, undiagnosed, mild symptoms, i.e. a tight chest or aches? So I'm going to send that over to Dorrit, please.
Thank you. Yes, we are working very closely under the leadership of our RD with the Danish authorities, and what they are actually implementing our package of recommendations according to the context and their ability to treat. So what the Danish authorities decided is to test, and with our support and encouragement, to test those that are severely sick, and now healthcare workers that are at the front line, or those that need to be checked because they are in the essential critical service of the country. Those that have mild disease in that category, together with the most vulnerable ones and those with complicated disease, are getting tested. We are also recommending to do the tracking and the tracing, the case tracing, etc. So the whole blended approach is being implemented. It's very important that each country tailors each to their own context. There is, as we say it all the time, there is no one size fits all. We have to look at the curve to understand what are the abilities and capacities of the healthcare system, how many beds in the hospitals, critical care, what can be done, and remember that the prevention side is still there. So it's very important to do it together from the prevention and the action. And I was very impressed with the RD Wipro that explained it so well with China. And we see it working in Europe as well. Thank you.
Thank you very much. And that question, you mentioned flattening the curve and the curve there. So I'm going to go over to Katie Smallwood to explain. We have a question here. Our embassy staff hear about flattening the curve, but what does this actually mean? Katie.
Thank you, Rob. So flattening the curve, we will all have heard that this represents what we should all be doing. So what does that mean? The overall objective for flattening the epidemic curve, which is the graph that shows the number of cases over time, the overall objective to flattening this is to achieve better health outcomes for people affected with COVID. And why does it achieve better health outcomes? Because in fact what it does is that it does two things. One, it gains time. By flattening the curve, you're also delaying it in time a little bit further. And you're pushing time and you're having new cases appear more slowly than they otherwise would. That allows you to gain extra time, this opportunity, this window of opportunity that our Director General used to talk about a lot, which is fastly closing on us, is also about delaying the curve. So then the other aspect of flattening the curve is reducing the concentration of cases in time. That means that instead of having 100 cases per day, you have 10 cases per day. And if you have 10 cases per day and you have a static level of health system and your health system is able to deal with 10 cases, then you can deal with those 10 cases as best as possible. But if you have 100 cases in one day and your health system can only deal with 10 cases, then those patients and those people will have worse outcomes because they're not getting the same level of care. And so everything about flattening the curve is being able to keep the number of cases over time below the threshold and the capacity, the maximum capacity of our health system. And if we can do that, we can buy time, we can get good outcomes, and we can focus on finding better therapeutics and a vaccine, and then overall the number of cases will decline.
Very good, thank you. And related to that flattening the curve, we have some individual questions flowing in now. This from the ambassador to Denmark and Iceland of Austria, who asks, all measures target to flatten the curve of infected persons right now. Must the aim be to keep these restrictive measures until a certain endemic steady state? What percentage is reached? I don't know whether you can interpret what that means and give us a response. So I guess this is, at what point can we take our foot off the gas in terms of the measures that are being imposed currently? Katie.
I can give a first answer, and I'll also hand over to Dorrit, because this is very similar to the question with regards to herd immunity. And it really comes back to what immunity will having the disease confer to us once we recover. And we don't know. So reaching that steady state, yes, it may occur at some point, but how or when and what that will look like, we just don't know for the moment. So over to you, Dorrit.
Yes, thank you. And we know our examples that we remember as humanity, the 1918 influenza pandemic. We remember the 2009 pandemic. What we know is that, or the SARS later on, each one has its own way. This is a new virus. We only know it 12 weeks now. And it's clear to us is what Katie said. There is no steady state reached yet, except we hear excellent news from China. And I think if we look at the Chinese way, that they did this blended approach and not waiting for anything passively. We need to be very active now. all countries need to take all the measures that are possible to flatten the curve. When we flatten the curve, we don't only look at the health services themselves, but we also include, of course, part of it is the healthcare workers. In many places, we will not be able to flatten the curve if the healthcare workers are not protected. In many places, we will not be able to flatten the curve if we don't do the social distancing and the contact tracing. In many places, we will not be able to do it if we don't take care of ourselves through the community and the community engagement. So we have the modules that are now tailored for each of our countries, and I think that would help us. We cannot wait for anything to happen. Steady state is something that you reach over time. We don't have that time. Thank you.
Thank you very much, Dorrit. And we have another question here. Questions are flowing quite nicely now. This one from the Deputy Chief of Mission for the Philippine Embassy. Do we have a suggested level of testing per 1 million population? Now, I think I'll expand on that question with adding the question, or ask you, Dorrit and Catherine, to say a few words about testing in different scenarios. With a more differentiated approach. Maybe you could explain that. But that's the question that's come in from the Philippine Embassy. Dorrit, please.
Yes, again, we are learning from each other, this new virus, and what we see is that they are different when we look at the curve. And, we have to understand that we don't have all the information in some places because the very light cases are not reported. But when we look at the most, the cases that are reported, tested, we see that if we test in the beginning of this, when we have only few cases or cluster, everything should be done to actually put them in and fill them, to know exactly where they are, these cases, and to social distance them, taking care of those that are acutely and severely sick. And at that case, you really test everybody that is around. But first, you social distance them from society. So they are the ones to be social distance, not society. Okay? That's the first one. When we go to the community transmission, where what we see is that we lost the case zero. When we don't know who is doing what, and it's very hard to contact trace, then we focus, depending on the capacity of the system, on those that are most in need to know, as we discussed, the priority ones. We don't have a rule of thumb how many tests you have to do per population. There is no such a thing. What we recommend is to also, while doing that active surveillance, to also do the surveillance for acute respiratory infections in countries, to have the background of activity that is not explained by influenza. So we have those two, and we are ready to, and we work together with the Ministries of Health to do it, and many countries are already implementing it. Thank you. Over.
Katie, do you have anything to add on what Dorrit said?
Nothing to add, just to re-emphasize really that WHO does encourage people to test all patients that fit the suspect case definition if they can. And we live in an imperfect world, and sometimes the context of the countries, the availabilities of testing kits need to be taken into account in those decisions, and we recognize that. And that's also why decisions do need to be taken at the individual and depending on the specific context of the country.
Thank you very much, Katie. Now we have a question in reference to RD Hans Kluge's opening statement, which regards the movement of people across borders. And the question is related to how WHO, how free we are as an organization to move in and out of member states with our support.
This question was discussed yesterday at the daily Health Security Council meeting. Daily, the WHO Director General with the 6 region directors and the senior management is convening to update on the situation and further synergize our approaches. And this is what I mentioned, that a measure in one country should really not impact on the other country, hence why we're really calling for global solidarity. And closing the borders should not draw the attention away of every country doing inside the country what needs to be done. We know what needs to be done on the containment and the mitigation. WHO does not recommend any restrictions on trade nor travel. Here I would like to put forth a fantastic positive example put in place by the leadership, the government of Montenegro, where the Prime Minister and the government exempted, when closing the borders, the WHO teams from that restriction. And that's a very strong appeal to all you excellencies, because we see requests increasing for assistance by WHO, so in that way WHO teams really need to have access. Thank you.
Thank you very much, Hans. Just a couple more questions before we go to some concluding remarks. One question here for Dr. Dorrit Nitzan, specifically to you, was to ask you, do you think that Europe was slow in responding?
Thank you. No, I don't think that Europe was slow in responding. I think that we had our window of opportunity, the European countries, and we can tell you that all European countries took the measures that were possible to take in order to be prepared. And that part included the whole health system and the whole of society preparatory work that was done there. Of course, the first ones, we should not forget that the first case was diagnosed in France. And that cluster was identified right away, sealed right away. Then we had cases in other countries, sealed. This actually protected us and gave our region time to be prepared. Of course, when it started to burn, as we see in some areas, just like in Wuhan, in China, and in other cities around the world, when it starts and you lose the patient zero, then you are moving on. But we learned a lot, and with the support of the WIPRO and the CRO and other regions in the world, we were wiser and we have more information now. And to add to what our regional director said, we are also collecting the data from each of the countries. We have our international health regulation focal points, and every day they report to us, and we see the actions, the measures, and everything that is done by the countries. And we want to commend them. We are here, our teams in the country offices, in the hubs, are working shoulder to shoulder with the ministry, and we are impressed. I think that we are going to do it. We still can, so we should remember that. Thank you.
Thank you very much, Dorrit. To Ambassador Kurce from the Croatian embassy here in Denmark, we won't be able to answer your question because I don't believe Dr. Søren Bostrom has managed to connect with us today. It is specific to the Danish numbers, the projections, and whether they will be significantly higher cases here in Denmark. And in his opinion, if there will be stricter measures introduced in the near future. We can't possibly answer that without Søren Bostrom on the line, but we will endeavor to get his response to that and send it to you, Ambassador, as soon as possible, soon after this call as possible. So I'm going to pass over to Dr. Moeti now. Dr. Moeti, I would just invite you to say a few words before I hand back to the regional director here in closing and concluding remarks from your side, please, Dr. Moeti.
Yes, thank you very much. I'd like to conclude first by thanking Regional Director Hans again for having organized this opportunity for us to pause, to reflect together, and really to exchange on the experiences of three regions, stimulated very much by the Excellency's questions, which have made us consider some options, possibilities, think about other things that we need to be doing. For me and my colleagues who are sitting with me here, it's been an opportunity to see how to work with global solidarity, work with partnerships across continental boundaries, if you like, and regions with the same principles with different contexts and achieve the same results that we all want at the global level, which is to put an end to this outbreak with a minimal of impacts to mitigate what impacts on health and other sectors and development in countries. And I look very much forward on continuing to work together, to reflect, to innovate, to learn together, and to apply what we have learned, and to encourage that interaction between the member states and our regions so that we can really see this global partnership change into a global synergy and joint action for this common purpose. Thank you very much.
Thank you very much, Dr. Moeti. Thank you for those remarks, and thank you very much for joining us. With that, I'm going to hand over to Dr. Hans Kluge to say some concluding remarks from our side. Thank you.
My sincere appreciation to you, Excellencies, for taking this time, to the Member States, to all my own staff as well of the emergency team, but also the other colleagues, because we are walking the talk and also repurposing the staff in our office to beef up our capacity. Let me repeat the 3 take-home messages, please. 1, please connect with each other and coordinate your responses and make sure that measures introduced by one nation help and do not hamper the response in another. 2, please continue supporting the response with resources and acting in solidarity, including all and leaving no one behind, particularly the most vulnerable. And 3, please encourage communities and sectors of your society to be engaged. Every Asian we heard is European, every European is Asian, every African is European, every European is African, every individual in the world is globally. I'm very humbled to be part of such a fantastic team of regional directors under the guidance of the WHO Director General. We stand united. It's a stress test for solidarity and psychological resilience, and we are going to make it united. Thank you very much, and have a nice day.
Thank you. Thank you very much, Hans. And just to close, I'd just like to say we didn't get to some of the questions. We will endeavour to do this on a regular basis with the embassies and entities represented here diplomatically in Denmark. We will answer those questions in writing bilaterally and to you all on the circular email. And just to assure you that we will keep repeating and informing you as frequently as possible on the COVID-19 response and preparedness. Thank you.